Plus, breaking news at 4 o'clock, the Affordable Care Act tax credit extension rejected. What this could mean for your premium in the new year. That is where we begin at 4 o'clock following that breaking news just out of Washington. Thanks for being with us. I'm Faith Jesse.
And I'm Ron Jones in for Cheryl Preheim. That rejection essentially guaranteeing that millions of Americans will see a rise in health care costs starting in January.
That's right. And ahead of the votes, Georgia Senator Jon Ossoff warned senators that Georgians will hurt if those tax credits aren't extended.
Senators will decide whether people live or people die. Senators will decide whether Georgians and folks across the country are financially ruined or have a shot. 500,000 Georgians, it's projected, will lose their coverage altogether. More than 1 million more will see their premiums double or worse. This is a choice.
Well, those votes today, an unceremonious end to a months-long effort by Democrats to prevent these COVID-19 era subsidies from expiring after shutting down the government over the issue in October.
That's
and we'll
right.
say that was a Democrat and Republican decision to do
Absolutely,
that as well.
absolutely. Bipartisan Karen Kafa reports from Washington and breaks down what the two plans that failed to move forward.
The Senate Thursday voting on dueling health care plans.
The motion is not agreed to.
And advancing neither.
The motion is not agreed to.
Hanging in the balance as Capitol Hill debates are enhanced Affordable Care Act subsidies set to expire at the end of the year. Experts say without an extension, skyrocketing premiums will financially cripple millions of Americans.
We need to do triage, and the first thing is to face the emergency that millions of Americans face when these tax credits disappear.
And the Democratic proposal put forth on Thursday sought to extend the subsidies by 3 years.
This kind of extension of health care subsidies is a very simple, straightforward, non-costly, politically imperative thing to do.
But Senate Republican leadership argues a straight extension isn't the right fix.
You can't fix this program. I mean, you can't just do a blanket extension without reforms. It is rife with waste, fraud, and abuse.
The Republican plan, which also failed Thursday, proposed to expand health savings accounts for consumers to help pay for some ACA plans.
The Republican plan is to put the money into the patient's pocketbook so that she has money to pay for the insurance out of pocket.
Any legislation passed in the Senate would need a sign-off in the Republican-led House before the chamber recesses for the holidays, as well as approval from President Trump, making a resolution this year unlikely. The nonpartisan Congressional Budget Office estimates a lapse in subsidies could lead to 2 million more people uninsured. In Washington, I'm Karen Kafa.
So House Speaker Mike Johnson says Republicans plan to put another health care package on the floor sometime next week.